Hiccups are involuntary spasms of the diaphragm, the muscle separating the chest from the abdomen, followed by the quick, noisy closing of the glottis. This closure stops airflow to the lungs. While brief episodes lasting a few minutes are common, persistent hiccups can last over 2 days or even a month. Persistent episodes, though uncommon, can be distressing and are more frequently observed in men. The exact cause is often unclear, but doctors believe it involves irritation of the nerves or brain regions controlling respiratory muscles. Brief hiccups often have no obvious cause, but can be triggered by various factors. Common triggers for brief hiccups include a bloated stomach, alcohol consumption, or swallowing hot or irritating substances. These often occur in social settings due to a combination of laughing, talking, eating, and drinking. Additionally, hyperventilation, which decreases carbon dioxide levels in the blood, can also lead to these involuntary spasms. Persistent hiccups may indicate serious underlying conditions. Irritation of the diaphragm can result from pneumonia, chest or stomach surgery, or the accumulation of waste products in the blood due to kidney malfunction known as uremia. When a serious cause is identified, the hiccups typically persist until the issue is resolved. Rarely, a brain tumor or stroke interfering with the brain's breathing center can cause hiccups. These cases are particularly difficult to stop and can be physically exhausting for the patient. Because persistent hiccups can be a sign of a significant health problem, a medical evaluation is often necessary. While brief episodes don't require medical evaluation, certain warning signs warrant immediate attention. These include neurologic symptoms like headaches, weakness, numbness, or a loss of balance. If hiccups persist for more than 2 or 3 days without these warning signs, you should still consult a doctor for evaluation. During an evaluation, doctors inquire about symptoms, medical history, and the duration of the hiccups. They will ask about remedies tried, recent illnesses, surgeries, and symptoms like gastroesophageal reflux, swallowing difficulties, cough, fever, or chest pain. They also investigate alcohol use and perform a comprehensive neurologic examination. A general physical examination might look for signs of chronic disease, such as severe muscle and fat tissue wasting. While testing is not usually performed for brief hiccups, it is recommended for persistent cases or when warning signs are present to rule out more serious underlying health conditions. Initial diagnostic tests typically include blood work, chest X-rays, and electrocardiography or ECG. Further testing is guided by other symptoms the patient may be experiencing. If initial tests do not reveal a cause, doctors might order an MRI of the brain or a CT of the chest. The most effective way to treat hiccups is by addressing the underlying disorder. For example, doctors may prescribe antibiotics for pneumonia or proton pump inhibitors for gastroesophageal reflux disease. Most brief hiccups resolve on their own, but various safe home remedies are available to try in the meantime. Many home remedies aim to increase carbon dioxide levels in the blood, such as holding one's breath or breathing deeply into a paper bag. While these methods are often only slightly effective, they are generally safe. These simple techniques provide a non-invasive way to manage brief, annoying episodes. Other techniques focus on stimulating the vagus nerve, which runs from the brain to the stomach. These include drinking water quickly, swallowing dry bread or granulated sugar, gently pulling the tongue, or stimulating gagging. Some even suggest gently rubbing the eyeballs to interrupt the hiccup reflex through nerve stimulation. For persistent hiccups where the cause cannot be easily corrected, medical treatment becomes crucial. Several medications have shown varying success, including chlorpromazine, baclofen, metoclopramide, and gabapentin. These pharmaceutical interventions are often the next step when home remedies and addressing the primary cause fail to provide relief. If medications fail, doctors may block the phrenic nerves, which control diaphragm contractions, by injecting a local anesthetic. If the hiccups return after a successful block, a surgical procedure called a phrenicotomy might be performed to cut the nerve, though this does not always guarantee a permanent cure. In summary, while the cause of hiccups is usually unknown, persistent episodes may signal a serious underlying disorder. A doctor's evaluation is recommended for long-lasting cases, even if a cause isn't always found. While many remedies exist, none has proven definitively superior to others for every individual.